Welcome to Anatomy DAHAR series. Today's topic is the tongue. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. The tongue. This is the sagittal sections of the head and neck. This is nasal cavity. This is oral cavity. This is the pharynx. The uppermost part of the pharynx is nasopharynx, which is behind the nasal cavity. The middle part of the pharynx is behind the oral cavity and called oropharynx, and the lowest part is behind the larynx called laryngopharynx. This is the tongue. The tongue is a mobile, striated muscular organ that can assume a variety of shapes and positions. It is also called lingua in Latin and glossa in Greek. The tongue is partly in the oral cavity and partly in the oral pharynx. The functions of the tongue include detect the sensations of the taste, the articulations of words during speaking, being involved in mastication, that is chewing, squeezing food into the oral pharynx, and oral cleaning. Parts of the tongue. This is the sagittal sections of the oral cavity and the tongue. The tongue consists of a root, tip, that is the apex, and the body in between the two. The root of the tongue is postero-inferior immobile part. It is fixed to the mandible in front and the hyoid bone below and behind. The tip, that is the apex, is a free anterior end that comes into contact with the back of the central incisor teeth. The body is a mass of skeletal muscle covered by mucous membrane and stratified squamous non-keratinized epithelium. The tip and body of the tongue are extremely mobile. Surfaces of the tongue. The diagram is showing the superior surface of the tongue. This is the tip in front. This will be the root behind. The tongue features two surfaces, superior, also called dorsal, and inferior, also called undersurfaces. The superior dorsal surface is convex on all sides, that is anteroposteriorly also convex and side to side also convex. It is characterized by a V-shaped groove called Sulcus Terminalis. The apex of the V is directed posterior to a small pit called the foramen cecum, the remnant of the proximal end of the embryonic thyroglossal duct, which developed into the thyroid gland. The limbs of the Sulcus Terminalis extend lateral and anterior to the insertions of the palatoglossal fold at the side of the tongue. This is again the superior, that is the dorsal surface of the tongue. This is Sulcus Terminalis. The Sulcus Terminalis divides the dorsum of the tongue into anterior two-thirds, that is pre-sulcal area, located in the oral cavity, and posterior one-third, that is post-sulcal part, located in the oral pharynx. Just anterior and along the Sulcus Terminalis, that is in the pre-sulcal area, up to 12 vellic papillae are located. See papillae slides later. The Sulcus Terminalis forms the inferior margins of the oropharyngeal isthmus, that is, the junction between the oral cavity and oral pharynx. There is an opening, oropharyngeal isthmus. The inferior margin of oropharyngeal isthmus is formed by the Sulcus Terminalis. The oral and pharyngeal parts of the tongue differ in their development, topography, structures, and functions. Superior surface of the tongue. This is the diagram of the superior surface of the tongue. The mucous membrane differs conspicuously on the two parts of the dorsum of the tongue. Anterior two-third, that is the oral part of the dorsum of the tongue, is covered with papillae and is velvety. This surface shows a shallow median furrow that divides the tongue into right and left halves. Posterior one-third, that is oropharyngeal part, is studded with tubercles, between which is smooth and glistening. The inferior surface of the tongue is covered with the smooth mucous membrane. The inferior surface of the tongue, oral part. This is the diagram. The mouth is open and showing the inferior surface of the tongue and floor of the mouth. The inferior surface of the tongue consists of number 1, a median fold called frenulum linguae. Frenulum means mucosal fold. Frenulum linguae connects the inferior surface of the tongue to the floor of the mouth. On either side of the frenulum is a prominence produced by deep lingual vein. The lingual nerve and artery are medial to the vein but not well visible. This will be the lingual nerve and this will be the lingual artery. They are not well visible. Lateral to the deep lingual vein, we have a fold of mucous membrane here called plica fimbriata. Plica means fold, fimbriata means a border that is directed forwards and medially towards the tip of the tongue. So you can see here number 1 is here frenulum linguae. Here is lingual artery, lingual nerve, you cannot see well, and this is deep lingual vein. Lateral to it is the plica fimbriata. Okay, inferiorly, if you see here, this is submandibular duct. Each is coming from the submandibular salivary glands. Each is open to the sublingual papilla. So submandibular duct open to the sublingual papilla. Papilla means small nipple-shaped projection. Look at the diagram, dorsal surface of the tongue. We are going to talk about posterior one-third of the dorsal surface of the tongue. Posterior one-third, that is the oropharyngeal part of the tongue, is behind the sulcus terminalis and palatoglossal arches. It curves downwards and forms the anterior wall of the oropharynx. So this oropharyngeal part, that is posterior one-third of the tongue, curves downwards and forms the anterior wall of the oropharynx. The mucous membrane of this part is devoid of papillae. However, it consists of mucous glands and many lymphoid follicles. They form lingual tonsil, which is part of the Walden's lymphatic ring. You can see this in the chapter for Palatine tonsils. Posterior most part of the tongue. Look at the diagram. This is a cross section showing the oral cavity, showing the dorsum of the tongue. This is the anterior two-third of the dorsum of the tongue. This is posterior one-third of the dorsum of the tongue, separated by sulcus terminalis will be here. Posterior one-third of the tongue curves downwards, and most inferior part is the part called posterior most part of the tongue. Posterior most part of the tongue is at the level of laryngopharynx. So we can see this is the epiglottic. This is dorsum of the tongue. And there are 3 mucosal folds between the tongue and the epiglottic called glossoepiglottic folds. The one along the midline is the median glossoepiglottic fold. On either side, on the right and left, we have lateral glossoepiglottic folds, altogether 3 folds. Lateral to the median glossoepiglottic fold, we have depression there. That depression is called vallicular. So vallicular is between the median and lateral glossoepiglottic fold. Lateral to the lateral glossoepiglottic fold is another fossa there called pyriform fossa. So, lateral glossoepiglottic fold separates the vallicular from pyriform fossa. Papillae. The dorsal surface of the anterior two-thirds of the tongue has lingual papillae. They are projections of lamina propria of mucous membrane covered with epithelium. There are 4 main types of lingual papillae. Number 1, filiform papillae. This is the one, filiform papillae. They are small conical projections and most numerous. They are pinkish gray in color and are arranged parallel to the lateral limbs of the sulcus terminalis and are responsible for their velvety appearance. They are sensitive to touch but do not bear taste buds. So filiform papillae does not have taste buds. The second type is called fungiform papillae. This is the one. Mushroom shaped, consists of a narrow pedicle at the base and a long red rounded head. They are scattered singly among the filiform papillae near the tip and margins of the tongue. Each fungiform papillae bears a few taste buds. So fungiform papillae got the taste buds, filiform does not have taste buds. The third type of papillae are Folly Papillae, formerly known as Circumvelli Papilla. It is circular in shape. Look here, circular in shape. The largest among papillae, about 1 to 2 mm in diameter, up to 12 in number, arranged in V-shaped row just anterior to the sulcus terminalis. We have already mentioned them. Each papilla is truncated, that is inverted cone shape, with a narrow base and broad flat top, surrounded by a circular sulcus or moat, which is about 2 to 3 mm deep and is bounded on its peripheral by lateral wall called velum. The duct of serous glands open into the sulcus, and many taste buds are found on both walls of the sulcus, that is on the lateral wall, velum, and on the Folly Papillae you will see many taste buds. The fourth type of papillae are Folly Papillae. They are small and very poorly developed in humans. Taste buds. This is a diagram of the taste buds. Taste buds are found in two types of papillae, fungiform and vellic papillae of the tongue. However, they can be found also in the soft palate, epiglottis, palatoglossal arches, and posterior wall of the oropharynx. They are piriform, that is, pear-shaped structures extends through the entire thickness of the stratified lingual epithelium. It is made up of modified columnar cells arranged perpendicularly to the surface. So you see, perpendicularly arranged to the surface these cells are. Each bud is a small cavity that opens to the surface through a gustatory taste pore. Three types of cell can be identified in the taste bud. Number one, sustendicular, that is the supporting cells. Darker cytoplasm with slender dark nucleus. Second type is gustatory taste cells. Lighter cytoplasm and more oval nucleus. The third type is basal cells, located near the basement membranes. Sustendicular and gustatory cells are spindle in shape. You can see spindle shaped. Their apical surfaces have long microvilli that protrude through the taste pore. Muscles of the tongue. The tongue has two groups of muscles, intrinsic and extrinsic groups. The intrinsic muscles are wholly within the tongue, attached to the deep surface of the mucous membrane, and have no attachment outside. However, all the extrinsic muscles have external attachments. The tongue is divided longitudinally by a median fibrous septum into two symmetrical halves. Each half consists of 4 intrinsic and 4 extrinsic muscles. Muscles of the tongue do not act single. The intrinsic muscles are responsible for the change in the shape of the tongue, becoming wide and flat, narrow and thick. The extrinsic muscles are mainly for the movements of the tongue: protrusion, retraction, elevation, depression, and lateral movements. Intrinsic muscles of the tongue. This is the coronal sections of the tongue. This is the hyoid bone. This is median fibrous septum, which divides the tongue into right and left halves. First, I am going to show you the extrinsic muscles of the tongue. This is Genoglossus muscles coming from the mandible. Lateral to it is Hypoglossus muscles coming from the hyoid bone, and lateral to it is Styloglossus muscles. They are extrinsic muscles. Now I'm going to show you 4 intrinsic muscles of the tongue. They are superior longitudinal, inferior longitudinal, transverse, and vertical muscles. The first is superior longitudinal muscle. It runs lengthwise beneath the dorsal mucous membrane. This is the one, superior longitudinal muscle. It shortens the tongue and makes its dorsum concave. Second is inferior longitudinal muscle. This is the one. It runs lengthwise near the inferior surface between the Genoglossus and Hypoglossus muscle. It shortens the tongue and makes the dorsum convex. The third is transverse muscles. It extends transversely from the medial septum to the margins of the tongue. It makes the tongue narrow and elongated. Fourth is vertical muscles at the border of the anterior part of the tongue. It makes the tongue broad and flattened. 4 extrinsic muscles connect the tongue to the mandible via Genoglossus, styloid process via Styloglossus, palate via Palatoglossus, and hyoid bone via Hypoglossus muscles. This is a diagram of the oral cavity and the tongue, and this is Genoglossus muscles. This is mandible, and this is superior mental spine of the mandible. This is body and greater horn of the hyoid bone. Genoglossus muscle. Anteriorly, it has a narrow tendinous origin from the superior mental spine of the mandible. The fibers of the muscle radiate backwards in a fan-shaped manner and are inserted into the mucous membrane of the entire dorsum of the tongue. Upper fibers to the tip, middle fibers to the dorsum of the tongue, and lower fibers into the body of the hyoid bone. So you can see here, this is the Genoglossus muscles, fan-shaped muscles, anteriorly attached by a very small narrow tendon to the spine, and throughout this dorsal surface it is attached here. A pair of Genoglossus muscles pull the tongue forward, protruding the tip out of the mouth, and draw the posterior part of the tongue forwards. They prevent the tongue from falling back, obstructing the respiration. Thus, it is called as safety muscles of the tongue. In paralysis of one Genoglossus on protruding the tongue, its tip deviates to the affected side due to the pulling forward of the opposite normal muscle. Hypoglossus muscle. Look at the diagram. This is the hypoglossus muscle. This is the body of the hyoid bone. This is greater horn of the hyoid bone. Hypoglossus muscles originates from the entire length of the greater horn and lateral part of the body of the hyoid bone. It extends upwards as a quadrilateral sheet of muscles, the upper border interdigitating at right angles with the fibers of the Styloglossus muscles. Look at it. The upper part, Hypoglossus muscle fibers interdigitate with the Styloglossus muscle fibers. Hypoglossus muscle inserted to the side of the tongue between Styloglossus muscle, which is on the lateral side, and inferior longitudinal muscles, which is the intrinsic muscle on the medial sides of the Hypoglossus muscle. This muscle depresses the side of the tongue and makes the dorsal surface convex. Relations of Hypoglossus muscle. Because Hypoglossus muscle is related to many structures, it is a key muscle in the submandibular region. Structures related to it are superficial to the muscles, that is, on the lateral side of the muscle, the structures are from above downwards. Styloglossus muscle, number 1. Lingual nerve, number 2. Submandibular ganglion, number 3. Submandibular duct, the green color, number 4. Submandibular gland, deep part, which is not shown here. And number 5 is hypoglossal nerve and its accompanying vein. Deep to the posterior margins of the Hypoglossus muscles, structures are glossopharyngeal nerve, stylohyoid ligament, and lingual artery. Anterior to this, we have sublingual gland and genohyoid muscle. These two groups of structures are not shown in this diagram. We are going to present structures related superficial to the Hypoglossus muscles and structures related deep to the Hypoglossus muscle. This is coronal sections of the tongue. This is hyoid bone. This is Hypoglossus muscles on each side. This side we are going to show the structures superficial to the Hypoglossus muscle. What are they? Number 1, Styloglossus muscle. Number 2, lingual nerve. Number 3, submandibular duct. Number 4, hypoglossal nerve and accompanying vein. They are superficial or lateral to the Hypoglossus muscle. This side we are going to show structures deep to the Hypoglossus muscle. They are A. Inferior longitudinal intrinsic muscle, B. Glossopharyngeal nerve, C. Stylohyoid ligament, D. Lingual artery, and E. Genoglossus muscle, which is very deep, together with the middle constrictor muscle. Styloglossus. Look at the diagram first. This is styloid process. This is hyoid bone. This is stylohyoid ligament. Let's talk about styloglossus muscle. This is the styloglossus muscle. It originates from the front of the lower part of the styloid process and the upper part of the stylohyoid ligament. Styloglossus muscle passes forwards below the superior constrictor muscle to be inserted to the side of the tongue, interdigitating with hypoglossus muscle fibers. This one we have already mentioned earlier. Styloglossus muscle draws the side of the tongue upwards and backwards. Palatoglossus. Look at the diagram. This is the medial view of the oral cavity and oral pharynx. This is tonsillar fossa. This is soft palate above and posterior 1/3 of the tongue below. Tonsillar fossa is bounded posteriorly by palatopharyngeal arch and anteriorly by palatoglossal arch. Deep to each arch, we have respective muscles. That is palatopharyngeal muscles inside palatopharyngeal arch and palatoglossus muscle inside the palatoglossal arch. Palatoglossus muscle. It descends from the undersurface of the aponeurosis of the soft palate to the side of the tongue. It is covered by submucosa, mucosa, and form palatoglossal arch, which is the anterior pillar of the tonsillar fossa. Palatoglossus muscles raise the root of the tongue, approximate two palatoglossal arches, and narrow the transverse diameter of the oropharyngeal isthmus, thereby shutting the oral cavity from the oropharynx. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching. The palate. What is palate? Look at the diagram. Palate is a horizontal partition separating the nasal cavity above from oral cavity below. Its upper surface forms the floor of the nose and the lower surface forms the roof of the mouth. The lower surface is a slight shallow dome to adapt the convex dorsal surface of the tongue. The anterior two-thirds of the palate are made up of bones called hard palate, anterior two-thirds, and the posterior one-third is mucomuscular structure and called soft palate. Lymphatic drainage of the nose, Robin's levels. The lymphatic of the nasal cavity starts from the capillary network in the lining mucosa. Posterior part of the nose drain into the retropharyngeal nodes, which are at the posterolateral part of the pharynx. Anterior part of the nose drains into the submandibular lymph nodes, which is called Robin's level 1B. This is the one. So level 1B receives lymphatic from the retropharyngeal nodes and finally to the submandibular lymph nodes. From level 1B drains to level 2. This is level 2, which is also called upper deep cervical nodes or jugulo-digastric nodes. From level 2, it will drain to level 4. This is level 4. This is also known as lower deep cervical nodes or jugulo-omohyoid nodes. From the level 4, lymph will drain to the jugular trunks, that is right lymphatic duct on the right side and thoracic duct on the left side, drain to the venous system. In summary, lymph capillary networks from the walls of the nose drain to the retropharyngeal nodes and from there to the submandibular lymph nodes, that is level 1B. From there drain to the upper deep cervical, also known as jugulo-digastric nodes, level 2, and from there lower deep cervical nodes, also called jugulo-omohyoid nodes, level 4, and finally through the jugular trunks, that is right lymphatic duct on the right side, thoracic duct on the left side, drains into the junction of internal jugular vein and subclavian veins. So finally enter into the venous system. Lymphatic drainage of the nose, Robin's levels. The lymphatic of the nasal cavity starts from the capillary network in the lining mucosa. Posterior part of the nose drain into the retropharyngeal nodes, which are at the posterolateral part of the pharynx. Anterior part of the nose drains into the submandibular lymph nodes, which is called Robin's level 1B. This is the one. So level 1B receives lymphatic from the retropharyngeal nodes and finally to the submandibular lymph nodes. From level 1B drains to level 2. This is level 2, which is also called upper deep cervical nodes or jugulo-digastric nodes. From level 2, it will drain to level 4. This is level 4. This is also known as lower deep cervical nodes or jugulo-omohyoid nodes. From the level 4, lymph will drain to the jugular trunks, that is right lymphatic duct on the right side and thoracic duct on the left side, drain to the venous system. In summary, lymph capillary networks from the walls of the nose drain to the retropharyngeal nodes and from there to the submandibular lymph nodes, that is level 1B. From there drain to the upper deep cervical, also known as jugulo-digastric nodes, level 2, and from there lower deep cervical nodes, also called jugulo-omohyoid nodes, level 4, and finally through the jugular trunks, that is right lymphatic duct on the right side, thoracic duct on the left side, drains into the junction of internal jugular vein and subclavian veins. So finally enter into the venous system. Pursuivant's ridge. Let's see the diagram. This is right lateral view. This is superior constrictor muscles. This is palatopharyngeus muscles. Upper fibers of these two muscles, that is palatopharyngeus and superior constrictor muscles, blend together. They sweep horizontally backwards to form a U-shaped muscle loop around the lateral and posterior walls of the nasopharynx. During deglutition, that is swallowing, when soft palate is elevated, this muscle band also contracts and shortens, forms a ridge called Pursuivant's ridge. It forms a sphincter around the nasopharyngeal opening and closes it together with the elevated soft palate and prevents regurgitation of food from the oropharynx into the nasopharynx. Longitudinal muscles, they are inner group of pharyngeal muscles. We have two diagrams here. This is lateral wall looking from inside, medial view. This is lateral wall looking from outside, lateral view. Okay, let's see the structures here. This is auditory tube, this is soft palate, and this is the pharyngeal region. In this diagram, here is the soft palate, and here is the styloid process. This is the pharyngeal region. So, inner groups of muscles, three longitudinal pharyngeal muscles are: number 1, palatopharyngeus, coming from the soft palate to the pharynx, coming from the soft palate to the pharynx. Number 2, stylopharyngeus, coming from the styloid process to the pharynx. And the third one is salpingopharyngeus, coming from the auditory tube to the pharynx. There are three inner groups of muscle, longitudinal pharyngeal muscles. Anterior relations of the oropharynx. Let's see the diagram first. We are in the oropharynx looking anterior, where we have the oral cavity is here. So the roof of the oral cavity is, you can see the soft palate here. On the lateral side of the oral cavity, we have two arches. The anterior one is called palatoglossal arch, made up of palatoglossus muscles. Posterior arch is palatopharyngeal arch, made up of palatopharyngeal muscles. Here, this is the dorsal part of the tongue. This is posterior 1/3 of the tongue. This is epiglottis. This is upper border of the epiglottis. Anterior relations of the oropharynx. Oropharynx anterior relations can be divided into two parts. The upper part, looking directly into the oral cavity, and the lower part, looking the structures below. Now the upper part, we are looking from behind into the oral cavity through the oral pharyngeal isthmus. It is bounded laterally on each side by palatoglossal fold made up of the muscle of the same name. So they form the boundary between the oral cavity and oropharynx. That means boundary between the oral cavity and oropharynx is the anterior arch here, the pillar here, that is the palatoglossal folds is the boundary between the oral cavity and oropharynx. Now the lower part, anterior relations, you can see here, this is the dorsal surface of posterior 1/3 of the tongue, which consists of lingual tonsils, upper free end of epiglottis behind the tongue, one median and two lateral dorso-epiglottic fold, that is in anterior surface of the epiglottic. There are three folds are there. We call dorso-epiglottic fold, one median and one each on the lateral side, connecting the anterior surface of the epiglottic to the dorsum of the tongue. Between these three dorso-epiglottic fold, we have a epiglottic valleculi. That is, you can see here, a shallow fossa. Each is between the median and lateral epiglottic folds in front of the epiglottic. In this diagram, we cannot see that vallecula. Walden's lymphatic ring consists of two paired and two single groups of lymphoid tissue I just presented in the previous slide. Paired ones are on each side. They are number 1, Palatine tonsil in the oropharynx. Number 2, tubal tonsil in the nasopharynx. Singles are number 3, nasopharyngeal tonsils at the junction of the roof and posterior wall of the nasopharynx. And number 4, lingual tonsils on the dorsal posterior 1/3 of the tongue. Okay, in the oropharynx. They offer not only the local defense but also produce lymphocytes for sending to other lymph nodes via the efferent lymph channels or vessels. Walden's lymphatic ring consists of two paired and two single groups of lymphoid tissue I just presented in the previous slide. Paired ones are on each side. They are number 1, Palatine tonsil in the oropharynx. Number 2, tubal tonsil in the nasopharynx. Singles are number 3, nasopharyngeal tonsils at the junction of the roof and posterior wall of the nasopharynx. And number 4, lingual tonsils on the dorsal posterior 1/3 of the tongue. Okay, in the oropharynx. They offer not only the local defense but also produce lymphocytes for sending to other lymph nodes via the efferent lymph channels or vessels. Nerve supply of the palatine tonsil, the sensory nerve supply. As you know, palatine tonsil is located in the oral pharynx. We know that sensory supply to the oral pharynx is from the glossopharyngeal nerve, that is the ninth cranial nerve. If it is so, mucous membrane of the tonsil is also supplied by the glossopharyngeal nerve. It may receive small extent of lesser palatine nerve of the sphenopalatine ganglion. Glossopharyngeal nerve also supplies the middle ear. Therefore, in tonsillitis, there may be referred pain in the ear. Nerve supply of the palatine tonsil, the sensory nerve supply. As you know, palatine tonsil is located in the oral pharynx. We know that sensory supply to the oral pharynx is from the glossopharyngeal nerve, that is the ninth cranial nerve. If it is so, mucous membrane of the tonsil is also supplied by the glossopharyngeal nerve. It may receive small extent of lesser palatine nerve of the sphenopalatine ganglion. Glossopharyngeal nerve also supplies the middle ear. Therefore, in tonsillitis, there may be referred pain in the ear. Tonsillar bed. Look at the diagram first. This is the horizontal sections of the lateral wall of the oral pharynx. Right lateral wall. Okay, this is anterior, this is posterior. This is medial or inside, this is lateral or outside. This is right lateral. Now let's talk about the tonsillar bed. Tonsillar bed means the structures over it palatine tonsil is located. Okay, this is the palatine tonsil. Outside it we have a hemicapsule of the tonsil. Outside it we have loose areolar tissue layer, very loose area, yellow in color, and there's a veins is there. Now structures forming tonsillar bed are: number 1, pharyngobasilar fascia. Number 1, this green layer. As you know, pharyngobasilar fascia is attached to the base of the skull. Lateral to it or outside this fascia is superior constrictor muscles. This is the superior constrictor muscles. Anteriorly, there's a raphe, that is the pterygomandibular raphe. More anterior to it is the buccinator muscle. So this raphe is between the buccinator and superior constrictor muscle. Outside the superior constrictor muscle is buccopharyngeal fascia. This red thin color is the buccopharyngeal fascia. Number 3, it covers lateral surface of the buccinator in front and lateral surface of the superior constrictor muscle behind. Lateral or outside this one is number 4, that is your Styloglossus muscle, which is slightly anterior. Okay, and then together with this Styloglossus muscle is glossopharyngeal nerve is there. These structures forms the tonsillar bed from inside to outside. More lateral structures related to it is number 6, facial artery and its branches. This is number 6, facial artery and its branches, tonsillar branches, and ascending palatine branches will be there. And number 7, slightly behind and lateral, is internal carotid artery. It is about 2.5 centimeter posterolateral to the palatine tonsil. Epiglottic cartilages continuation. This is a diagram, superior view of the oral cavity and laryngeal cavity. This is the root of the tongue, and this is the larynx. This is epiglottic. Between the tongue, glossus, and the epiglottic, we have three mucosal folds, one median and another two, one on each side, lateral glossoepiglottic folds. Between the folds, we have shallow depression called vallecula. So, between median and lateral vallecula, and here median and lateral, another depression called vallecula. Epiglottic cartilages continuation. This is a diagram, superior view of the oral cavity and laryngeal cavity. This is the root of the tongue, and this is the larynx. This is epiglottic. Between the tongue, glossus, and the epiglottic, we have three mucosal folds, one median and another two, one on each side, lateral glossoepiglottic folds. Between the folds, we have shallow depression called vallecula. So, between median and lateral vallecula, and here median and lateral, another depression called vallecula. Lateral structures of the tonsil. We are going to talk about so many lateral structures of the tonsil. Look at the diagram very carefully. You have to know that this is not horizontal section like previous diagram. This is a coronal section, vertically cutting down. This is below inferior, this is above superior. Here is the tongue, epiglottic, oropharynx is there. Here is the soft palate, above will be the nasopharynx. That is on the medial side. Okay, this is the medial surface of the palatine tonsil. This will be the lateral surface of the palatine tonsil. So what are the structures on the lateral side of the palatine tonsil? Number one is fibrous tissue is there forming half capsule called tonsillar hemicapsule. This green color is there. Tonsillar hemicapsule is there. Outside this one, this yellow color, second layer is subcapsular peritonsillar space. This is formed by loose areolar tissue. Whenever there is a place called loose areolar tissue, usually, commonly, abscesses are formed. So in this layer, quite often, abscesses may form, called quinsy occurs in this space. In this loose areolar tissue, usually, as usual, veins will be in the loose areolar tissue. So this is paratonsillar vein will be there, which comes down from the palate, go down along this one. Now lateral to this one is pharyngobasilar fascia, number 3, green layer. You know, quite often we said about this. Coming from where? Coming from the base of the skull. This is the pharyngobasilar fascia. We have already mentioned that will come down, okay, from this side, okay. Then after this, next to that one is the fourth layer. That is the superior constrictor muscle, okay. Then next to that one is this red layer is there. That is the buccopharyngeal fascia. Okay, this is the one, buccopharyngeal fascia. Buccopharyngeal fascia covers the lateral surface of the buccinator muscles in front, and behind is the superior constrictor muscles. Okay, lateral to that one is plexus of pharyngeal nerve and plexus of pharyngeal veins are there. So these are the structures lateral to the tonsil. You have a tonsillar hemicapsule. Next to that one is the subcapsular peritonsillar space. Next to that one is your pharyngobasilar fascia. Next to that one is superior constrictor muscles. Next to that one is the buccopharyngeal fascia. And finally, outside that one is plexus of pharyngeal veins and plexus of pharyngeal nerve.